and you can introduce
Great. Well,
yourself.
thank you. Thank you so much. I think we'll introduce ourselves as we roll along. It's not going to be all slides. There's going to be a lot of experiential material, and if you are not in a position to do the material, I think there will be a recording so that you can try out some of the practices a little later. I'm Julie Brefczynski-Lewis. I'm a neuroscientist here at WVU. We have been working as a team for quite some years, and what's really promising is some of the science behind mindfulness. But what we want to really emphasize is if mindfulness isn't your game, something that produces equanimity, peace, relaxation, find something, take care of yourself. That's our main message. So most people are familiar with mindfulness. John Kabat-Zinn created mindfulness-based stress reduction as a program in the 70s for heart patients, actually. And it's really blossomed into a variety of mindfulness-based interventions that usually have the components here, which we're going to be trying little samples of throughout the hour. Most of them come in the form of an 8-week intervention program, but it doesn't necessarily need to be that long to have an effect. But this particular program is on burnout, and I'm imagining with the situation working with people who have substance abuse are going to have challenges with burnout and working with that kind of population. So this happens to be primary care physicians. Not exactly the same population, but just know they don't have a lot of time. They're not meditating for 20 minutes a day, and yet they're still having pretty powerful effects. So all of them were in a state of burnout, and after the 8-week intervention, all three of the primary dimensions of burnout, that emotional exhaustion, personalization, and lack of professional efficacy, were all improved. In particular, right after the 8-week course, there was an improvement. But what is striking is that 12 months later, 15 months later, those effects even seem to improve more. And with depersonalization, they actually only became significant after that year. It's a little more intractable, that numbing wall that we tend to put up as a defense mechanism when we get burned out. Empathy, anger also improved, and that's probably also due to that dimension of depersonalization. Fatigue and tension also improved significantly. Now, there are thousands and thousands of mindfulness-based intervention studies that have been published. This one in neural image is kind of cool. It does work with a addiction population of just smoking, but I think that it has, at least for me, it showed kind of the magic sauce of why mindfulness works. And this author, Judson Brewer, if you want to take a deeper dive into the world of mindfulness interfacing with addiction, Judson Brewer's work, he has a book called Craving. He has great research on his site. I highly recommend. But in this one, they were comparing mindfulness to cognitive behavioral therapy for smoking. And what they found is that mindfulness, compared to the cognitive behavioral therapy in the orange, reduce the reactivity. And what did they have as a stimulus? Individualized stressful scenarios that they recorded for each person about their own personal stresses, like divorce, legal matters, really stressful material they played for them in the MRI scanner. And in the amygdala, that reactive region of the brain, that stress reactivity was predictive. That reduction in stress reactivity predict the reduction in smoking. So the less reactive that they became with the program, the more likely they were to be able to quit smoking immediately post-treatment, as well as at the 3-month follow-up. So that's kind of promising. Awareness and acceptance, they wrote in their discussion section, seemed to be the key components. It was more powerful than avoidance and reduction. And this was, wow, my screen sharing stopped, but I'll get that right back up. Another, just down the road, I-79, David Creswell has done some really exciting research where he really believes that it is the equanimity aspect of the mindfulness instructions that's the most powerful. So I'm going to have to kind of go through the slides. There we are. They varied the instruction of mindfulness, and if they took out keywords like non-judgmental, if they didn't mention the being in the present moment non-judgmentally, then mindfulness seemed to lose its effect, which could be why that physician's worked for burnout didn't have to be practicing mindfulness as much as adopt the attitude of being just aware of how you're feeling in the present moment in a non-judgmental way, having that equanimity. If you want to take a deeper dive, this is a great video. I'm not going to play it here, but hacking your brain's reward system to change habits is wonderful for even people without substance abuse disorder. I think it's been really helpful for me in terms of how considering awareness to kind of hijack the brain's reward system.
Hey, Julie.
So there have been a couple. Yeah.
Your slideshow's in presenter mode, so we can see like the next slide coming up.
Oh, interesting. Let me try to change the display setting. Did that help?
It's loading for me right now.
Okay. I will give it a moment. I'm going to move on.
Looks good for me.
Yeah, it looks
Okay,
good for
I
me
just
too, Julie.
duplicated the show. So yeah, I have two screens, so it seemed to be showing my other screen. But anxiety, depression, pain, addiction seem to be the types of things where mindfulness has the most power. These are in large-scale meta-analyses. The effect size is moderate, and you all know that you're not going to get the strong effect size when we're dealing with anything that is psychiatric or mental health. So it is encouraging that you're seeing an effect size in interested participants that's similar to other studied therapies. Loving kindness and compassion seem to be even more beneficial for things like depression and also traumatic brain injury, which I don't show here. So here you are learning to use emotions in an intelligent way without burnout. Because if you know, people talk about compassion burnout, becoming overwhelmed is not so helpful, right? And to give an example of this is from my postdoc era where I was training long-term meditation experts to do these computer tasks, which was a challenge in and of itself. When we played for them the sounds of like a screaming woman, if they were doing mindfulness, they shut down their amygdala. And the more practice they had, the better they were at shutting down amygdala. Now, I got criticism for that study. Why? Well, you're turning your emotions off. It basically sounds like depersonalization is to some people, or turning into Spock. Well, the same subjects, the same scanner session, when they instead were instructed to do a compassion meditation, had even more amygdala. So they were responsive. You notice I said responsive and not reactive. They had that flexibility and control of the mind to be able to have that sympathy response, but able to also go into feeling stable and feeling mindful. So they could turn that on and off. And that's the practice that one gets from doing these exercises. Because if you don't turn off the amygdala, you get distress. When people talk about compassion burnout, it's really no different than regular burnout. And usually what you mean is empathy distress, or a combination of empathy distress and maybe not knowing exactly what to do. As a parent, there's so many of those cases where you're not exactly sure, is this the right thing to say to this person at this time? That adds a distress element as well. This painful winds predicts turning away from suffering and depersonalization, and the oblique eyebrow expression of sympathy predicts helping behavior. So note, it's not turning off emotion, right? This is a wonderful study that was done not with compassion or, mindfulness at all, but just sympathy. So they showed pictures of real children who were orphaned in, at that time, a recent hurricane. And when they saw the picture of this child, the amygdala comes online. It's sad. This child is a real child who lost their parents. And that is the humane response. However, in the next few seconds, so that amygdala happens at 6 to 8 seconds, then by the time you get to 10 to 12 seconds, they can choose to give some money to that orphanage, just a really small amount. And then they get nucleus accumbens reward. You get that dopamine burst of, hey, I was able to help, even just a little bit. And then the amygdala turns off. And note that if they chose not to give money, they don't get the nucleus accumbens, and they don't get the amygdala stays on longer. So that could be an indicator of that distress response. And here we saw that it doesn't have to be money that you're giving. You are all working with patients. You are giving your time. You are bearing witness. You are giving your presence, right? That is something that you can appreciate within yourself. And when you appreciate what you're doing, that could activate nucleus accumbens. So in this case, in Helen Wang's study, also in the same Richie Davidson's lab, when they just gave the wish, may they be well, to someone who was suffering, that activated nucleus accumbens as well. And it also was highly connected with prefrontal cortex. So that control, that ability to, okay, amygdala, we can quiet you down now. We're doing something. We're caring. And so if you don't turn the amygdala off, it talks to the HPA axis, releases cortisol, and that sustained cortisol is very deleterious, which is why when we teach loving kindness and compassion meditation, we sandwich it between mindful stability. So that's what we're going to move into with the yoga and with the mindfulness experiential exercises in this session. It's just as if even more important than the compassion. But if you practice the loving kindness and compassion, you can practice that mental agility that can be very useful for the type of work that you do. It's sort of like an astronaut becoming comfortable with their tether, so they can go into the dangerous territory of outer space, and you're going to the slightly dangerous territory of other people's kind of chaotic lives, right? They're strong emotions, but you know that tether is there. You can come back in your body. You can come back to your breath. And the more you practice, the more confident one can become. And also finding the joy of just being the net. You know that you're not going to capture everyone. You may just be planting a seed in their head, and somewhere along the line, you might be giving them just a few moments of respite in their chaotic lives. Appreciate that. Don't say, oh, I can only be happy when I have a success case, because, we know the success rates in mental health are, that would be a little challenging. So we're going to get right into doing some of these practices because that's where the magic is.
Oh, thank you, Julie. Thank you. Hi, everyone across the state. Thank you for coming to listen to us today. And I hope with what we share can be of value to you. I'm Laurel Faulkenberry. I'm an outpatient therapist at Chestnut Ridge, and with the mindfulness team. And I'd like to share today, first of all, an acronym that's very powerful and very simple, like a lot of things in life are. Some of the most powerful things are the most simple. And this acronym comes out of a book, a manual, and I highly recommend this manual. It's called Mindfulness-Based Relapse Prevention for Addictive Behaviors. So that's Mindfulness-Based Relapse Prevention for Addictive Behaviors. And so this acronym is SOBER, the sober breathing space. And I'd like to guide you through this. If you could imagine anything that's been challenging lately, a challenging conversation, a challenging encounter, mildly challenging, something that kind of put your hairs on end a little bit or triggered you, so to speak, and you felt like reacting versus responding. So if you could think of that, and if you can't if nothing comes to mind, that's fine. You can just follow along with how I'm going to lead you with the acronym of SOBER. So if you're not driving, you can put a fuzzy gaze down or close your eyes if that's comfortable. And the first thing you're going to say to yourself is, I'm going to stop. I'm going to stop and I'm going to step out of automatic pilot. I'm going to step out of automatic pilot because I feel like I'm going into automatic pilot. Automatic. I've been triggered. I'm going to react. So I'm stopping and I'm stepping out. Stopping and stepping out is super powerful just in itself. But then we're going to go to the O of sober. O, observing what's happening to you right now in this very moment. What are some of my thoughts? A feeling or two, bodily sensation. How is my body talking to me? Acknowledge what's happening. Kind of like a scan of your body, of thoughts, a feeling or two, bodily sensations. And now, bringing your attention to your breath. Taking a nice deep cleansing breath, and on the exhale, letting it go a little longer. And returning to a nice even breath, the rising and fall, maybe feeling the rising and fall of your belly or your chest. And allowing your breath to anchor you into this present moment. So allowing your breath to kind of anchor you. And you've observed, so you observed your thoughts and feelings, you came into your breath, the B. So we've done the S-O-B. Now we're coming into the E. Expand your awareness to include a sense of your body as a whole. So expanding your awareness gently, focusing on your breath, sensing your body. And now the R of responding mindfully with awareness to the array of choices that are in front of you. There's an array of choices. How can you best take care of yourself in this moment? What choice honors you the most? So you're responding with awareness and compassion for you. And now just slowly open your eyes if it's closed, and then just notice how stepping out, observing thoughts, feelings, sensations in your body, breathing, focusing on your breath, helping let that anchor you into this moment, this present moment, bringing you back to the present, and then expanding your awareness to include the whole body, all your sensations, and then responding with compassion and care for yourself. So just notice how that felt. So we can share this with our clients and patients and ourselves. This helps every human being, these steps. So let me see how much time I have. Okay. I'd like to share just a couple more things that it's really important, and Julie mentioned this in the science, is to validate your feelings and name your feeling. Once you can name your feelings, so sharing again this with our clients, patients, and yourself, we're all human beings. Once you can name a feeling, it takes the zing out of a strong emotion. Once you can name, like, I'm scared. I'm scared. I'm angry. Once you can name the feeling, I'm anxious. Once you can name it, it calms the nervous system. It helps to calm the brain. The brain likes to know what's going on. So validating feelings, naming them, very powerful for feeling safe in the body and quieting the nervous system so that you can respond with more compassion and kindness to yourself. And then meeting your needs for connection and sense of community. We know as people that work with addictions that community is crucial, connection is crucial. When we go down the rabbit hole, when we want to isolate, ooh, it's not a good place, not a good place. So we need for people to come out, have a sense of safety in the connection, sense of trust, and a growing sense of community. And I think that's about it for now. I'm going to come back and we'll do a guided mindfulness meditation, but let's move on now to Heidi for some movement, yoga, and breath work. Heidi.
Hi, everyone. Laurel and Julie, thank you. Well, I'm Heidi Sherwin, and I am a yoga educator in Morgantown, and I am with the mindfulness team. And if you're in the Morgantown area, I do want to share that every Monday and Wednesday, I offer classes at the Health Sciences Building. It's in the Wellness Studio from 5:15 to 6 p.m. So if you're in the area, those classes, it's a free resource for people with WVU to come. It would be wonderful to see you. But I'm going to be sharing, each of us, Julie, Laurel, and I, we come in with like our own little like specialty, our own little bag of like, what we do out in the world and what jazzes us up. And I'm here to share movement and some breathing practices, or just some really just like breath watching practices that we'll play with. These are two things that have helped me. I always share, like, probably since I was out of the womb, right? Since my first breath, I'm a mover and I'm a breather, and that helps me when I want to find my own emotional regulation. So today we're going to be doing some movement. We will sit for a bit for some movement, and then we'll stand. If you're in a place that allows you to stand and you want to, you can stand with me. But if you're in a place where you really can't do a lot of this, you could watch it later. Also, just like listening and thinking about how that might feel. So if you're driving and we're doing something, just kind of thinking like, oh, how would that feel in my body? There's a lot of power to that too. So we're going to start actually seated, and I'm going to scoot back, roll back a little bit, and I think I'll spotlight myself. And there we go. You can see me. I'm going to scoot back, got a nice little rolling chair here. So in my seat, I'm scooching up just a little bit because of the height of the seat. I can feel my feet better onto the ground. If that's the case with you, go ahead and scooch yourself so you can feel your legs to your feet and you feel really grounded. If I were to sit all the way back, I'm like, woo, I'm like floating around. And this helps us just really connect earth into the body. So start with your hands on your legs. And in Mindful Steps, we offer kind of a signature series of movement called 6 Movements of the Spine. And it's something that you can just keep in your back pocket. I just feel like I need to move. Because when we're, in service with others, when we're taking care of others in the many different ways we do, one way we can take care of ourselves is to allow movement and somatic activity to help kind of release some tension that we might be holding. Because I know for myself and my work, and even just simply as a mom, when I'm listening, right, in the work of listening, I sometimes do get tense in my shoulders and tense in my neck as I'm listening, as I'm caring, as I'm offering empathy and compassion. And I need to remember to take care of myself to let some of that holding go. So the 6 movements we're going to do will help alleviate some kind of hardness that we carry. Not hardness like, oh my God, so hard with our shell, but just the tension that comes about with the work we do. So for the 6 movements, it's front, it's back, it's side to side, that's 2, and then twisting, rotation to get the 6. For front and back with your hands on your legs, start to move your hands towards your knees and let your back round so your belly will move towards the back of your seat. And then to create more of a back bend shape, you'll bring your hands to the top of your legs. Let your shoulders roll open and back, and maybe let the chest lift slightly. And then you'll go back. You'll round the spine. Hands will move more towards your knees. Maybe you breathe out here. And then as you breathe in, you start to sit tall. Let those shoulders roll back. Lift the chest. And let's take 4 more. Just go at the pace of your breath. You exhale, round, belly draws back. Inhale, sit tall, and then let the shoulders roll open. Exhale, round. Inhale, sit tall, roll it open. Let's go 2 more. Exhale. Inhale. And exhale. And inhale. And now from that movement back and forth, pause and get a sense of yourself a little more in neutral. Feet to the ground, noticing your seat, supported through your back body. And then release your hands from your legs. I'm going to turn towards you a little bit more now. And now a little cross. To get into our side bending, we'll add some breathing in with some cross movement. And I find this bilateral movement, again, helpful for me with my own emotional regulation. And so things that I offer my yoga clients, I also try to remember like, oh, right, I can do this for myself and it helps me too. Of course. So bringing this for you with your arms by your side, with your right arm, as you inhale, bring your arm up, straight up like you're raising your hand. And as you exhale out through your mouth, release the arm and go like HA, like you're fogging a mirror. Left arm now, inhale in through the nose like you're raising your hand. And like a soft sigh, HA. Go back to the right. Inhale. Exhale. Go at your pace. I might be slower or faster than you. Inhale, left arm. Exhale, left arm down. One more time each side. Left arm. Right. Now right arm, bring it up, raise your hand, keep it there, and now lean to your left. Here comes our side bend. And leaning any amount to the left, you might notice right side of the body starts to get a little more space there. Left side gets a little hug. It's like you're noticing the experience in the body, taking it in, get your snapshot. And on your next exhale, release. Inhale, left arm up. And now lean to your right. And you're here. Timeline, a few breaths. You create the shape. Taking care of you, lean a little or a little more. And just start noticing how as you breathe, there's a conversation with the shape. Nothing to like force or make happen. And now as you exhale, come back out. Nice. Both arms now. Inhale, reach it up. Exhale out to the side. So almost like, remember when we had snow? Like what? Like last week, 2 weeks ago? Like little snow angels. Arms sweep out and up. And exhale down. 2 more of these. Inhale. Exhale. All right, this is the last one. Bring those arms up. And exhale. And now to greet a twist. Once your arms come down, with your left hand, let it cross now over the midline to rest on your right leg. And with your right hand, just hold it on your hip, right? So if you're like standing and holding your hands on your hip, but left hand's on your thigh, right hand on your hip. Now from your center, from your trunk, start to turn to the right any amount. If the back of your chair gets in the way, you could slide that right hand behind your back instead of sticking it out to the side. So moving into your twist, listening to the body as it twists. And sometimes twists, it's like, oh, it's that ringing out as we move in, not to like stop the breath, but it just feels that nice massage across the trunk. And now release, come back out. If you need to, reset. And now let your right arm cross the midline over to your left leg, left hand on your hip. From your center, start to turn. So your trunk turns to the left. Again, if your left elbow gets in the way, maybe just slide the hand behind your back to relax the elbow down. And you're moving in to feel. Like it's okay to feel. That's what some of our yoga postures invite us into. This kind of safe movement of feeling your body alive with a new shape, feeling the breath in the shape. And then release to let that go. Both hands back to the legs. Right? And just take a moment now from all of that 6 movement activity. Just be back in your center zone. And then feel your feet. We're going to move off the chair. Again, if you want to, come up off your chair to stand. And then once you come to stand, we'll take a balancing posture. I'll move this out of the way so you can see me better. Now in the balancing posture, first, hold your hands out with your palms up, like you're holding 2 trays of cookies. And just so you know, these are not like expensive cookies. It's really okay if they fall on the ground, right? They're like vanilla wafers, right? I mean, we don't want those to fall either, but you know, it's like, it's okay. They might fall, but it's like you're holding 2 trays of cookies. And then step into your left foot and maybe even go like, hey, this is my left foot. I affirm left foot to the ground. Shift into your left leg and slowly start to pick your right leg up. And again, like, oh man, I'm about to drop my cookies. But then you feel your feet or feel your foot. Feel the little teeter-totter. It's okay to play in the zone of balance. That's where our strength and resilience come, and learning where we navigate to center. Nice. Maybe 2 more breaths. Keep the cookies on the tray. Release the right foot. All right, for a moment, because it kind of feels nice to do it, right? You're just like, drop the cookies. Shake them out. We'll get new trays. Shake that out. And then we'll go to the other side. So now go back to holding 2 trays of cookies. With your right foot, like actually give it just like a little energy into the ground. Feel that leg alive. Push into the foot. And then slowly start to shift into the foot, right leg as you pick up your left. A little or a lot. Maybe playing with that even. How does that feel to lift the left leg up? Teetering a bit with the scales of the cookie trays. Gathering a sense of moving towards a balancing experience without too many shoulds. Like we gotta take it easy on ourselves. A moment to play. These postures offer that too. And now let that go. Left foot comes back down. Step into both feet. And then let the cookies fall. Because sometimes that just happens. And then we come back to our mountain pose. Settling here from balance. Now feel both feet grounded. If you want to, like a little pitter pat, like press your feet down into the earth. Like I affirm my stance here. And then start to feel your legs go strong. And I know you can't tell because I have bigger pants on, but I'm just holding myself up a little stronger through my legs. I feel my thighs alive. And then I'm gradually letting my spine grow tall without any rigidness. Offering a little more ease across my chest, shoulders down to arms. And then I welcome back a moment, very similar to Laurel's offering of sober. I offer a moment in mountain just to be in the center of experience. I stop moving a lot to step into stillness. I observe the moment just as it is. I sense and feel my body breathing. The simple act, the simple science, the simple, it's that magic of breathing is this connection of the space around. So now expanding your attention a bit, expanding with breath. And then responding in a way that shows you care. You care for you, a moment for you. One hand to your belly, one hand to your heart. I'm allowed to feel. I'm allowed to take care of me. I'm allowed to feel anchored in this moment and respond from my anchoring. As I take care of me, I take care of others. I welcome you here, this moment, this sober, standing moment. 3 more breaths, and then we'll take a seat. And if you're standing, you can release your hands from that connection to you. You can find your seat again and find a comfortable seat. I believe Laurel is going to be leading us into a short practice here. Thank you so much for allowing me to share some movement and breath.
Oh, Heidi, it's always wonderful. Thank you. Thank you.
Oh, thank you, friend.
Oh, so in this space of being inside of yourself, coming into you, coming home to you, you can close your eyes or fuzzy gaze down or look at something pleasant in front of you, whatever's most comfortable. And then let's return to your breath. Maybe on your next inhalation through your nostrils, feel the temperature. Is it warm or cool? And on your exhalation, is that temperature in your nostrils warm or cool? Maybe noticing the temperature of your room against your skin. Maybe feeling your clothing against your skin. And allowing your breath to flow like the gentle waves on the ocean. Easy in, easy out. Nowhere to go, nothing to do, just being present here now. And on your next exhalation, allowing your shoulders and jaw to drop just a little bit more. Letting go just a little bit more. Trusting this present moment to hold you. Now, noticing your next thought with kindness and compassion, without judgment or criticism. It's just a thought. No good thought or bad thought. Just a thought. And observe it with the viewpoint of a 5-year-old. Oh, look at that thought. Is it heavy or light? Sharp or soft? Be curious. And take your time. When you're ready, just gently bring your awareness back to your breath in your body. And probably there's another thought waiting in line, or maybe they're clamoring one over the other. Whichever thought you notice first, just observe that one as well. And notice again if it's a future thought, a past thought, a current one. Notice whatever you notice about that thought. And when you're ready, gently and kindly, once again, guide your awareness back to your breath, beginning anew each time. Each time you're beginning anew. There are no goals to achieve, no thoughts like we are going to become thoughtless. No, there'll always be a thought. We're human. That's what the mind does. So when you feel yourself lost in a thought, just go, oh, okay, I'm going to come back to my breath. And just feel your breath in your body again. It's a practice of coming back over and over again. And now let's notice if there's a feeling. Notice if there's a feeling in your body, an emotion. And if there isn't one, that's okay. But if you notice one, maybe see where in the body you feel it. Your stomach, your chest, your throat, your head. Where do I feel that feeling? And maybe label it, give it a name. What is this feeling? Is it heavy or light, sharp or soft? Just observing it with compassion. There's no good feeling or bad feeling. It's just a feeling. And when you're ready, once again, guiding your awareness back to your breath in your body. And this is a practice of returning again and again to your breath. And now just bring your awareness back to your room, your feet grounded to the earth for strength and stability. And close your eyes if they're open. And just notice whatever you're feeling, and it's all okay. If you're feeling anxious, okay, cool. If you're feeling relaxed, great. If you're feeling scared, great. Whatever you're feeling is okay. And thank you for sharing in this mindfulness meditation with me. And now we'll move on to Julie.
I promise this won't go very long. We're just going to do a very short compassion meditation. And if you've had a particularly difficult day, you can focus on loving kindness, which is the wish for happiness for others, or you can focus on someone who has been suffering. It's good practice for when you are with a patient or client. Now the mindfulness sandwich, whichever practice evoke that stability for you, feeling your feet on the ground, maybe the seated mountain, or some of the breath work that Heidi led us through. Feeling stable, feeling inner body instead of a floating head. And from that space of equanimity, evoking someone that we care about, maybe someone who generally brings a smile to our face, but might be suffering a bit from stress or some pain, worry, grief. Take a moment to bear witness. This might feel a little sad, but then springing towards that wish and allowing yourself to feel the reward of that time, that wish, seeing them relieved, wishing them happiness, ease, healing or resilience, strength. Feel the reward and warmth of that. And then back into your body. Feel that stable connection with the ground. And now, if you wish, you could stay with the stability, or maybe you might think of a client or patient that you've encountered that provokes some compassion for you. Bear witness, then spring towards that rewarding wish. May they be well. I'm taking time, and that's good. May they feel peace and healing, strength and resilience. And I plant that seed. And now back into the body, not taking too long in that emotional space, rooting yourself. And as Laurel instructed, noticing whatever you might feel, non-judgmental, curious. Maybe a longer out breath. As we come back to the room. So that is the compassion practice. It can be long or even super short. Something evokes a little pang in you. May they be well. May I be in my body. It can be so quick, but make a really big difference. As you saw in the brain difference in just seconds, that transformation from amygdala to reward and prefrontal cortex can happen with a little practice. So those people were not long-term experts in that study. They had just learned the practice 2 weeks prior. So if you have any questions, this is a time where we would like to open up. I don't know if we can get the three of us like a panel. I don't know this Zoom room as well.